Have you ever struggled with a difficult patient in the OET speaking test? Are you unsure how to stay professional and calm and keep control of the conversation? Many candidates panic when faced with an anxious, angry, or uncooperative patient. In this video, I'll show you some practical strategies for how to handle this situation calmly and confidently so that you can pass your OET speaking test with the highest possible grade. Let's start by talking about why it's important to be able to handle difficult patients in the OET speaking test. Well, the examiner is looking for many things. Among them is how you can stay calm and professional when dealing with a realistic situation. As you know, in many healthcare settings, you will often be faced with someone who is feeling stressed, anxious, or upset. So it's very important that the examiner can see that you are able to handle this kind of situation confidently. Now let's talk about the different types of difficult patient that you might encounter in the role play. First up, we have the angry patient. A patient might be angry if they have been kept waiting for a long time, if they've had a previous bad experience. An angry patient can be quite intimidating, which makes them difficult to handle. Now let's move on to the anxious patient. There are many reasons why a patient might be anxious in a healthcare setting, but among them could be anxiety over procedures, or anxiety over test results, or not knowing what the future holds for them. Anxious patients are probably among the most common type that you'll encounter in the role play, so it's very important that you know how to handle them. Next, we have the non-compliant patient. This is a patient who refuses to take your advice or follow particular medical procedures or even take their prescribed medication. An uncooperative patient might also be a little bit angry as well if they don't want to follow your advice. For uncooperative patients, it's important that you're able to handle the situation calmly so that you can convince them that you are the professional and they should listen to you. And finally, we have patients with unrealistic expectations. These may be patients who are demanding test results immediately, they want to see a doctor right now and they're not willing to wait, or maybe they were asking you to do something that's outside of your profession. Again, for a patient with unrealistic expectations, it's important that you're able to stay calm and appropriately handle the situation. Now let's go through some key strategies for dealing with difficult patients. Number one is to stay calm and professional. You should avoid reacting emotionally. Remember, if the patient is exhibiting a strong emotion, your job is not to react, but to stay calm and reassure them. Try saying something like, "I understand this must be difficult for you," to help them see that you are empathizing with them and hopefully help to calm them down. Always use a neutral, professional tone to help you stay calm in these situations. Next up is to use empathy and reassurance. Something the examiner will be looking for in the test is your ability to empathize with the patient. So whatever they're going through, make sure that you show you understand and that you're there to help. Try saying something like, "I can see that you're worried," or "I can see that you're frustrated. Let me explain how we're going to help you." This should help to make the patient feel more relaxed and open to listening to you. Remember, when you're showing empathy and reassurance, keep your body language open and non-defensive. The next tip is to clarify and provide solutions. How can you do this for each type of patient? Well, if they're angry, make sure that you begin by apologizing and then focus on resolving the issue. Reassure them that you're there to help and offer solutions to their problem. If the patient is anxious, start by reassuring them and then make sure that you go step by step through whatever it is they're anxious about. If it's a medical procedure, explain it step by step so that they can understand what's going to happen. If the patient is non-compliant, ensure that you explain the risks of not complying and the benefits of following your advice, but don't be too forceful or threatening. By following this step of clarifying and providing solutions, you're going to help the patient to feel calm and trust you. The next tip is to maintain control of the conversation. You are the healthcare professional, so it is your job to steer the conversation in the right direction. If the patient interrupts you or takes the conversation off track, steer them back to what you're supposed to be talking about while still acknowledging their concerns. Try saying something like, "I understand your concerns and they're definitely valid. Let me explain how we're going to address this." Keep your answers structured and to the point, and don't get drawn into arguments with the patient. Now I'm going to show you some example role-play scenarios and give you ideas for what you could say to help keep the patient calm. Example 1 is the angry patient. This patient is not happy because they have been waiting a very long time for their appointment. They might say something like, "This is ridiculous. I've been waiting out here for hours." How can you calm that patient down? You could say something like, "I completely understand your frustration and I'm sorry that you've been waiting so long. We're trying to assist everyone as quickly as we can today." In this way, you've acknowledged the patient's anger, you've said something to empathize with them, and then you're moving on to start offering solutions. Next up, we have the anxious patient. This patient is worried because they have to do some kind of procedure that they don't really want to do. Maybe they're worried that it will be painful or uncomfortable. You could say something like this: "I understand you're a little bit concerned about the procedure, but let me assure you that most patients only find it mildly uncomfortable, and I'll be here with you every step of the way. If at any point you feel uncomfortable, please let me know so we can stop." Here you can see that I've stayed calm and I've also showed empathy to the patient's feelings, but explained how the procedure will work to hopefully reassure them. Next up, we have the non-compliant patient. This patient is refusing to take their medication. They might say something like, "I don't see the point in medicine, I don't think it works." Here is something you could say to that patient. "I respect your perspective, but let me explain to you why this medication is important and how it's going to help you to recover." This is a good response because you've acknowledged the patient's feelings or opinions towards their medication, but you're guiding them into understanding why it's important for them to take it. Now, we've talked about how you can handle these difficult patients. Let's now have a look at how the examiner will score you, because in order to get a high score in your speaking test, it's very important to understand what you're being assessed on and how you can demonstrate this for the examiner. First up is relationship building. This is assessing your ability to show empathy, to reassure the patient and build a good relationship so that they trust and listen to you. Next is understanding and incorporating the patient's perspective. This is seeing if you're able to listen to the patient's concerns, show that you're listening, and address them appropriately and adapt your responses to address any concerns they talk about. Next is providing structure. This is your ability to keep the conversation focused and organized so that you can guide the patient calmly. And finally, we've got appropriateness of language. Is your language suitably professional but also reassuring? Do you use medical terms appropriately or explain medical terms to the patient in a way that they can understand? Now, mastering all of these skills is going to help you stay in control of that role play situation and show the examiner that you can confidently handle any kind of patient. Now, handling difficult patients is challenging, so you do need to be prepared for this. Make sure that you get plenty of practice so that you can impress the examiner on exam day. How about you? Have you ever had to deal with a difficult patient in the OET speaking test? Let us know in the comments below. And if you're looking for more expert tips on how you can pass your OET speaking test with flying colours, I recommend that you check out this video next.